Thank you. So the next speaker we've got, I believe, is Stuart Jordan. And Stuart is talking about implementing protections in hospitals. And Stuart is a member of the Unite Health and Safety representative.
Oh, thanks very much. I'm really glad to be speaking here today. So I'm a community mental health nurse and, as I said, health and safety rep with Unite. So I think John really eloquently explained in the plenary session how the NHS has failed the most basic test of any health service during the pandemic. It's failed to take an evidence-based approach to infection control. And as a result, it's failed to do its utmost to protect patients from avoidable harm. And this is very obvious to us in frontline services because the substandard infection control measures were putting us and our families, our loved ones, at risk also. It became very obvious to me that the normal clinical channels for raising patient safety concerns were not effective. And that led me to, in 2021, to try and find more effective means, and I became a health and safety rep. And since that time, with the other reps, my trust, and the NHS really doesn't have very many health and safety reps, compared to other industries. But the team that we started organising large-scale inspections across all our hospital sites and started campaigning for an evidence-based approach to infection control. And those inspections have grown. We've recruited new reps. We've built a campaign. We've built a large body of evidence for those infection control measures that we've been demanding. We've got two central demands. I'm glad to see they're also the demands of this conference. So full sick pay for all, and the right to breathe clean air. So I'll just talk about those very briefly. It's worth noting that right at the start of the pandemic, the Department of Health issued a directive to NHS trusts saying that any worker operating in NHS buildings should be able to isolate on full pay. And that guidance linked that to infection control. It said this is a requirement for infection control purposes. Now, it's worth just thinking about that for a minute, because this was an admission by the government that decades of outsourcing casualisation in the NHS had created a high risk situation. It created an unnecessary risk of infection within the health service and contributed to a hospital-acquired infection. And secondly, it was an admission that the government's miserly statutory sick pay scheme was entirely inadequate and was going to undermine the public health effort. And those things played out because in the NHS, that policy was at best enacted very half-heartedly and inadequately, and large groups of outsourced workers did go through the pandemic without any rights to pay time off if they had to isolate. It also had wider implications on the rest of the workforce. So the TUC reckons about 12 million key workers didn't have pay if they had to isolate, couldn't afford to isolate. And I think that also explains very low levels of compliance with isolation rules. I think there was a 2020 report in September 2020 which said 4 out of 5 people were breaking isolation rules. Most public health measures was very strong. On the clean air issue, I don't think it's well understood outside of the health service. Clean air, technologies to sort of clean the air are important everywhere, obviously. But in the NHS, unless you're working in ITU, you got no more protection if you were providing patient care for a COVID positive patient than the average member of the public was advised to take when, doing their weekly shop at the local supermarket. So we got the same level of respiratory protective equipment, and there were no measures taken to improve air quality. So the things that we've done in my trust, we've organised, we've gone around, we've got the CO2 monitors, we're identifying places where ventilation is poor, which is across the hospital estate. We've managed to push back on mask wearing, so we have got FFP3 masks for COVID positive patient care. We've won some sick pay for outsourced workers. And I think the lesson is that we've got this incredibly powerful piece of legislation in the Health and Safety at Work Act, and we can use it. We can use it to collect the evidence we need to win these infection control measures, and we can use it to organise our colleagues and build the kind of organisation we need so that we cannot be ignored by those in power. And the pushback we've had is entirely about resources, and we're facing £2.2 billion worth of cuts in the NHS this year. That's cuts the Tories started and this Labour government insists continuing. And at root, this is about whether or not we as a society want a health care system that is safe and effective, and it's part of that broader battle to save the NHS.